Hello everyone, welcome to Dentospedia, which is the premier platform turning dental board exam aspirants into a certified winner. So today I'm going to teach you a short topic on oral hygiene index simplified from the module of pediatric dentistry. So let's begin with the topic. So see, OHIS Simplified Oral Hygiene Index is given by John C. Green, John C. Green and Jack R. Vermillion in 1964. So please keep this in mind. Now see, the OHIS is a clinical method used to assess the oral hygiene status of an individual, providing a simple, quick and reproducible score. It involves evaluating only six specific index teeth to represent the condition of the entire mouth. Understand? Now see the components of OHIS. See, the OHI has two main components that are measured separately. First is debris index simplified and second is calculus index simplified. See, debris index simplified measures the amount of soft foreign matter, plaque and food debris on the tooth surface. Understand? Then calculus index simplified measures the amount of hardened deposit starter on the tooth surface. The final OHIS score is the sum of the average of debris score and calculus score. Understand? So OHIS is the sum of the debris index and calculus index simplified. Understand? So see, next is index teeth selection. There are six specific index teeth which are used. So we take 11, 16, 26, 36, 31 and 46. Understand? So these six teeth are index teeth. You can see in the image as well 11, 16, 26, 36, 31 and 46. Now of 11 you take the labial surface. Understand? Now 16 buccal surface, 26 also buccal surface, 36 you take lingual surface, 31 labial surface and 46 also lingual surface. So you can just remember it with a T. Understand? T. Buccal, buccal, labial and labial. Understand? And rest to this it will be lingual. Understand? Now what if 16 is missing? You will take 17. Now you will take the adjacent tooth if the index teeth are missing. Understand? Now see the scoring criteria. The scoring criteria. See both the debris and calculus index component uses a scale of 0 to 3 for scoring the tooth surface. Now first is debris index. So see, first is 0. No debris or stain. 1. If there is a soft debris which cover less than 1/3 of the tooth surface. You can see here in the image. Next is 2. Soft debris covers more than 1/3 but less than 2/3 of the debris. Understand? You can see in the image. Now 3, if the soft debris covers more than 2/3 of the surface. Understand? So this is debris index. Now next is calculus index. Calculus index criteria. You can see 0 for no calculus, 1 for supragingival calculus covering less than 1/3 of the surface. Number 2 will be supragingival plus isolated subgingival calculus covering more than 1/3 but less than 2/3. Number 3 will be supragingival calculus plus continuous subgingival calculus and covering more than 2/3 of the surface. So this is the scoring criteria of calculus. Now the calculation steps. See, you have to examine each of the six index teeth. Understand? Now you have to score debris and calculus score separately on the specified. Now you have to add the score and divide it by the number of the surfaces examined. Understand? You can see the formula. Debris index total debris plus number of surface you have examined. Understand? Same as well with calculus. Now the OHIS score will come by making the average of debris plus calculus score. Understand? So this will be OHIS. Now you can see the inference. You can see for debris index and for calculus index, if the score is 0 to 0.6, it will be good. If it will be 0.7 to 1.2, it will be fair. For 1.3 to 6, it will be poor. Now for overall OHIS, there will be a different interpretation. For good, it will be 0 to 1.2. For fair, it will be 1.3 to 3. For poor, it will be 3.1 to 6. So please learn these interpretations by heart. Understand? This is very important from this aspect of dental examination. Are you getting my point? This was Oral Hygiene Index Simplified. So for these kinds of detailed video, please download our app Dentospedia, and please do like, share and subscribe our Dentospedia app. Thank you very much.